Linked to salmonella, a bacteria that's typically connected to raw meat, eggs, produce, not snack foods.
Recalls are now in effect for products like Honey Smacks and Swiss rolls due to one common ingredient, whey powder. Dr. Mandira Mehra is here from SSM Health to explain why we're seeing this strange salmonella contamination. And it is really strange to me, at least.
It is strange and it's troubling because, like you said, these are some of our favorite snacks. These are the snacks our kids are eating.
Leah is very concerned.
So sad.
Yeah.
Goldfish, that's my life.
Goldfish is like the most innocuous snack out there. I mean, every little kid, I feel like, has a little pack of goldfish and they're snacking on it, and it's so yummy and cute. But, you know, in this case, let's take some precautions. This is a precautionary advisory step. There is no evidence that anybody has gotten sick, which is great news. But let's take a second to talk a little bit about salmonella. Salmonella is typically known, like you said, with egg, raw meat, uncooked chicken. And when you get salmonella contamination, you basically suffer nausea, vomiting, potentially severe diarrhea, stomach cramps, usually within 12 to 72 hours of getting infected. This, of course, can require hospitalization. It can be deadly. Most cases, though, are self-limiting, and people are able to treat it just at home. If you do, of course, have this outbreak and you suspect perhaps it was in response to this, you definitely want to contact the FDA, the producer, something like that. But there is a recall on these products. Moving forward, though, we always have great tips for our viewers, and things like you always want to wash your hands and any surface that may have been contaminated with salmonella. In this case, it's not the raw meats and the eggs and things like that. It's that actual whey protein. And whey protein is added to so many things now to increase its shelf life. So I wouldn't be totally surprised in the next coming weeks if we hear of a few other products that may also be precautionarily recalled.
And are we seeing this sort of infection, this contamination, more often? I've never heard of it in goldfish.
That's a great question. And are we seeing it more often, or has the FDA gotten better at detecting it?
Right. Sure.
And so the way it's usually passed is through a fecal-oral route. And so the question is, we have such great baking mechanisms, sterilization. Why are we catching it more and more? You hear of hummus and spinach getting E. coli, and you hear of all these things every year now. I think our mechanisms for catching it are just getting better.
We have about a minute left, Dr. Mehra. We wanted to ask you about a recent study that linked a woman's fertility, ability to have children, and their risk of dementia down the line. I mean, this seems like a strange connection, but what do you take away from this?
The takeaway here is we are beginning to really look in the medical community at how diseases are different in men versus women. And that's hormonally, that's perhaps environmental exposures. So you think of stroke or heart attack or other risk factors where you say, wow, they present so differently in those populations. Now we're looking at Alzheimer's, and we're saying, why does it present differently in women? Why are 2/3 of Alzheimer's sufferers women? In this case, this was such a fascinating study that said if women had more than about 3 children, they had a 12% less risk of Alzheimer's. So, of course, not to say at all that if you have 3 or more children, you will not get Alzheimer's. But fascinating study. Why is this association there? Is it because of the estrogen? Is it environmental factors? The more reproductive years a woman had, they also had a lowered risk factor. So a lot of questions to be answered here.
Right.
We still have to figure out the mechanism of action, but it is fascinating to know that that connection is there, and why is it there is going to be the next question.
Yeah, more to come.
Interesting study and some good tips on avoiding salmonella contamination. All right, thanks so much for joining us.
Of course, great to be here.
Good to see you. 6:17 right now, and if you've always wanted to own